Welcome back to Spine and Dine podcast. And today we're going to talk about back pain and macro splits.
So we're going to be talking about back pain and the perfect macro split. So I'm going to ask Mira, what is the best macro split? It's a question what's plagued me for years, especially in my younger days. I'm sure it's plagued many other people as well. And he's going to ask me some questions around back pain, and we're going to sort of hopefully dispel some myths. So
I'm guessing specifically lower back pain, right? Because that's the most common.
Yeah, that's the most
issue.
common. It's the most one. It's one what affects most people worldwide. And it's the one with the most years lived with disabilities, etc., etc. So yeah.
To start with, maybe it'd be nice. Do you have any statistics on how many clients you see with issues with lower back pain?
Oh God, in myself, in my clinic, a good proportion of my clients is back pain, probably around about 70%, maybe just off the top of my head, followed by neck pain, sort of upper back pain, followed by shoulders, then probably followed by sort of hips and knees. That's generally speaking. But if we're looking outside of the clinic and we're looking at the statistics, back pain effects, and this is lower back pain. When we say lower back pain, we're talking about from the 12th rib, okay, which is kind of like around about here, down to the buttock line. Anywhere in between is classified as lower back pain. So on average, back pain affects around about 500 million people each year. Okay, there's a prevalence of 500 million people. Now, 85 to 90%, depending on where you're looking, is caused, 80 to 90% is what we call non-specific back pain, which means we don't have the test to identify what structure is causing this back pain with the current knowledge we've got. Then from there, about 5 to 10% is sort of radiculopathies, spinal stenosis, discs issues. I guess sciatica would come into that 5 to 10%. And then less than 5% or just under 5%, we've got sort of fractures, vertebral fractures. And then 1% would be infections, cancers, all the really sort of nasty stuff, cordoequina, which is a compression of the spinal cord. I think spondyloarthropathies are probably a little bit more, maybe around 5%, but don't quote me on that. So you can see a big proportion of it is non-specific, meaning we just don't really know what it is. And the problem is, what I find with this is, because we don't really know what's happening, we tend to make up pretty bullshit sort of narratives of why a person's back pain's hurting. So, I've done all my tests, ruled out the nasty stuff, and then it's a case of, oh shit, hey, this pelvis is wonky, this pelvis is out of place, or this leg, you've got a leg length discrepancy, or you're doing X, Y, Z wrong, or there's a weakness here, there's an imbalance here. We give all this sort of no-seebic sort of language to give a narrative of why somebody is in pain.
If you would have to generalize, like very generalize, could you pinpoint the simple reason why people feel lower back pain?
No.
Could you say that it's linked to mostly sedentary lifestyles, or not exercising properly, or being not flexible enough, or?
I wish we could, but you can't. We know that there's some risk factors for it. It's driven probably by many different factors, and I guess it's if we've got a lot of these factors on their own may not cause back pain on itself, but if we start to add all these up together, and then that has the potential to lead to lower back pain. But I don't think we can ever put it down to one particular thing, unless there's been a traumatic experience, okay, where it's led to a fracture or etc. But other than that, non-specific back pain, no, I don't think we can tie it down to one single thing.
Yeah.
It's always very multifactorial.
Yeah, I do have some anecdotal experience because I did suffer with lower back pain before. And I've seen so many different experts telling me so many different things. And if I could pinpoint what actually helped me, it probably was getting my hamstrings stronger and more flexible.
Mm-hmm. Yeah.
Is there any evidence behind that? Or?
Well, it just goes to, not necessarily, but there's evidence for a lot of things what gets back pain better. But the problem is everybody's got their own story how they got better, right? So it just shows there's no one cure. There's plenty of different cures. Maybe it is just most of the time people will get better. But during that time where natural history is doing its favorable course in getting you better, you're just focusing on X, Y, and Z. Now that could be strengthening and lengthening the hamstrings. It could be dog walking. And them two people get better over time, and one person puts it down to strengthening their hamstrings and flexibility of their hamstrings. The other person's, well, I took my dog a walk every single day, and that's what got me better. So we just tie it down to the thing what we're doing over the sort of natural history time. So it don't really mean what we should be doing. I think just trying to get back to a sense of normality is probably the biggest thing there. Now, of course, I'm all in favor of using exercise as an intervention, so I'm biased towards any sort of exercise intervention with people with back pain. But generally speaking, most people should get better from a bout of back pain in roughly around about 8 weeks.
Okay. Yeah, I'm very biased towards strength as well, because a lot of these experts I've seen, they recommended, a lot of stretching and a lot of using, tennis balls and rolling and trying to do different types of massage therapies and all of that. And it would always solve the problem just that day. If I would be feeling back pain, I would roll my piriformis and okay, it will feel a bit better. But until I actually got a proper strength-based program, I was always relying on these massages. And then when I got stronger and more flexible, especially in the hamstrings, like I said, I can get away with way more. Usually I would do a once then session. Before I would do one training and then I wouldn't be able to move. And I was at the point where even bending over the sink to brush my teeth was painful. And now I can do so many sessions and as long as I keep my strength up and flexibility, I'm good.
Yeah, I mean, I'm a big believer in that as well. And let's take the lower back and let's make it as best as we possibly can in every sort of scenario and situation. So for example, let's make sure it can bend, round, twist, and all these vulnerable positions what we get told about or not to go in. So make it fit for purpose there, but also make it able to withstand weight, whether that be moderate, heavy for that person, whatever it may be. And I think having that variability, in my opinion, is the best way forward where we can sort of, mitigate any sort of episodes of back pain. So yeah, I'm fully with that, and I do a lot of sort of hamstring stretching, flexibility training, and training my back in weird and wonderful ways. And I don't really have much issues with my back. Every now and again, I get a little sort of right-sided sort of back pain. I think that's from a pre-existing pretty bad disc injury I had, and so that just highlights itself. But again, it may just be there very slightly in the background after I've done a heavy lift session, depending on where I am in my training week, how much I've been training. So there's a lot of other variables as well what I will look at. So I don't tend to fret on it too much if it does creep up.
Yeah. So if there's someone listening or watching who is experiencing back pain, what could they do at home immediately to maybe do a bit of testing and see if they can solve it themselves before they see any health professional like yourself?
Yeah, it's good. I mean, obviously, I mean, it's quite an in-depth question to go in and start to screening yourself. You know, in fact, we can touch on that on another podcast. But like I said, there's 500 million people worldwide throughout the year who suffer with back pain. 80 to 90% is non-specific. Now, obviously, that's very specific to the person because it's very painful. But that non-specific probably means that things are going to be okay and you will get better within 8 weeks, okay? So the majority of people will get better. So it's a case of just having a positive mindset. Don't give the pain too much attention and just try and continue with normal life. Know that it's probably going to be a bit of a shit show the first sort of 2 weeks, but you will rapidly get better.
But you'll get better only if you do certain things.
Well, no, you will get better if you just do anything. You know, it does have a favorable history. But I would always be, let's move and let's exercise through this, whatever they want to really do. And I think that's giving them more of a confidence to be like, oh, actually, I was able to do this and it hasn't flared my back up. And then the next time we go back to do some movement, you know, we might do a little bit more or push it a little bit more. We might walk faster. We might jog a little bit faster. We might, you know, move from a squat into a sort of Romanian deadlift in the gym. And it's just building that confidence back up and just building the threshold back up. What I would say is the best thing and why exercise is so effective. Not so much with making things stronger.
But then if there is someone who is in so much pain that they can't really exercise or do these things, they probably should see a professional.
Yeah, you can see a professional, but then again, I just try and find where that person's at. Because obviously they're going to be an intolerance to movement. So for example, really painful when we bend forward. Okay, so a classic one, what I do, if you can't bend forward when we stood up, I'll get them to do a cat-cow. We're basically on all fours and we're extending and flexing the spine. So I get them to flex the spine. If that feels okay for them, great, we'll move on to the next stage, which for me is a seated good morning. Okay, so I'm just sort of rounding it back through there. And we're just changing the environment so it's less aggressive for the person who's stood up tall or stood up and then bending forward.
You were actually, maybe we can touch up on this. You were telling me last time that you had this client who was trying different professionals in terms of his back pain. And he was that type who couldn't really bend over that much. Yeah. And he saw you, and within a few weeks he was touching his toes.
Yeah. And don't get me wrong, not everybody's like this.
Not everybody's like that, but it's a good example of like how different approach can completely change.
Yeah. You know, and again, so to give you some context, he had like a 5-year history of back pain, constantly there, seen a chiropractor, had x-rays, told his spine was misaligned, and then went on like 12 plus week adjustment block, which was okay. Didn't really give him any exercises to follow up with. Also seen a physio at his workplace on and off, and he would just get giving stretches to him and a little bit of acupuncture. And then he come to see me, and I assessed him in clinic, and everything was absolutely fine. But, you know, he didn't really. It was a bit boring examination. The only thing what we found is when he stood tall, bend forward like 10 degrees, 20 degrees before, he's like, that's painful. I don't want to go any further. So what we did do is we got him to do some cat-cows, and that was okay for him. A little bit of pain, you know, but it's kind of eased up as we sort of pushed into a little bit of pain. I also got him to do some deadlifts and some squats. Now, deadlifts, he felt a bit of an ache in his back. Squats was absolutely fine.
That's interesting.
So we picked the squat and we picked a cat-cow more. And I gave him them 2 exercises. And I saw him a week later and he was 70% better.
Wow. And so just to touch up also on that, so he saw these professionals, he saw chiropractor before, he saw physiotherapist. Did they give him any diagnosis that, like, when he came and saw you, that he was like, oh, this, they told me is wrong with me, but in actuality, like, he was fine?
So I think the chiropractor gave a diagnosis of misaligned spine. Okay, which is bullshit, you know, which is like, fuck, again, non-specific back pain. We can't really find out what's happening. We'll x-ray his spine. Oh, you know, this is misaligned. It's bullshit. The physio, I don't really know. I can't remember what he said. He's like, I don't think the physio really diagnosed him. And in that case as well, like, I couldn't find anything wrong. So the narrative I gave, I was like, hey, look, we've ruled out all the nasty stuff. We're quite confident that it's nothing to do with the nerves, all right? Everything's nice and strong there. There's no sort of altered sensation. There's also none of this happening, so we can rule all that stuff out. So that leaves us with, a bit of a sore back. Now, what we need to do now is, it's a bit annoying because we don't quite know what's happening, but it's good that we know it's not the nasty stuff. So what we need to do now is concentrate on getting you back fit, putting you as a bit more of an active component in your recovery, and not just going places, lying on a bed and thinking, I'm going to be touched up and feel better, okay? So that's kind of what I do. And then we just find ways where it can move. I do a little bit of soft tissue work, we did a bit of spinal manipulation, that stuff had a positive effect on him.
So you did realign his spine.
I did, yeah, I did crack his back and unlock the innate intelligence.
How is that possible that he went for an x-ray and clearly the chiropractor saw the x-ray and still gave him a diagnosis that he's got misaligned spine?
I think it's a sales tactic, it's one to create sort of vulnerability in the person, and use that as a marketing tool to get that person to come back or to buy into a sort of unneeded heavy treatment package,
Yeah, that's it's not nice. Anyway, I also wanted to ask, so you mentioned that you tried squats, deadlifts, and the cat-cows thing. I would say, at least from my perspective, a lot of people are scared of deadlifts when it comes to lower back pain. Why is it, and why they shouldn't be scared?
I mean, it's an exercise where we're putting stress and load through the back. So, and a lot of people get a little bit too much ego. And then, it's kind of that last straw on the camel's back where predominantly the back will hurt when we're doing deadlifts because, it is putting a lot of load through the spine and hips, okay? But it's perfectly safe if we just start to progressively load it up and, we don't exceed the boundaries what we're capable of, because then we're at probably a little bit more risk for generating small injury or a little bit of pain. So I don't think a deadlift should be feared at all. I think it's a great exercise. But again, we have to progressively load things up.
Would you say that deadlift is important in the exercise routine for everyone?
No, not necessarily. Not necessarily. I don't particularly deadlift.
Yeah, I don't deadlift either.
I don't deadlift. I do a lot of snatch and clean and jerk, which is a kind of fast deadlift from the ground.
There's a bit of deadlifting in there.
So, I do a lot of hinging. I'll typically do like a Romanian deadlift just to sort of put that stress through my sort of back chain, my posterior chain. But I don't really typically deadlift, I've never really enjoyed it. Yeah. Never really found it to be beneficial for what I'm doing.
I do. I think I got this from you. That I really enjoy Jefferson curls.
Yeah.
Which for a lot of people, when they see it, they probably think, oh my God, this is the worst thing for lower back pain. And actually, that's been the best exercise that I've ever done for it and for my hamstring flexibility.
Yeah.
Since I started doing it, I was mostly always being able to touch my toes. I got long legs, by the way. So it was always a struggle. I would always have to get warm to touch my toes and stuff. Pretty much since I got stronger in Jefferson curls, I can touch my toes and mostly flat hands on the floor any point. I could be cold, it's fine.
Yeah.
Just works.
It's a good exercise.
Yeah.
It works very well if you're looking to increase range of motion, if you're looking to show off on Instagram, if you're looking to build confidence. I think it plays on all of it. And I think why people advocate it so much is because I really do think it's a big confidence builder, and not just for Jefferson curl where we're loading it, but any sort of pike variation. So a standing pike, just standing tall, hinging at the hips with a knee straight. or a weighted pike, elephant walks, squat to pike. You know, I use them all the time in clinic to familiarize people who have pain and who are a little bit like, don't really like to bend forward. So I think over time, it's that exposure to that position where people become, all right, I've been in here plenty of time now over the last few months. This is a piece of cake, okay? I haven't got that anticipation of bending forward into that position. And I think that's the biggest win when it comes to any sort of like forward pike position.
Yeah.
Then you get byproducts of, you know, looking cool.
Yeah. Well, feeling cool. I mean, every time, even when I sit in front of a computer for a long time, I feel like I'm stiff, blah, blah. I do like a few elephant walks and like, I'm good.
Yeah. I love it. Every time I tie my shoes, I just go into a single leg pike, you know?
There you go.
I love it. You know, it's easy. You know, don't even bend that knee.
There's definitely...
Just bob straight into it.
Yeah, I think the confidence is a huge actually thing, because you realize that you can do something that a lot of people cannot do. Like everyone should be able to touch their toes, right? Really.
Yeah.
But you know they cannot. So then when you touch your toes, you're like, oh, I'm different.
I'm superior.
I'm superior, yeah.
Yeah, you know, I use it a lot of time. I think it's a great exercise. I don't really give, to be honest, I don't really hand Jefferson curls out too much. Obviously, give it you when we sort of program some flexibility work for you, but you was a bit of a different kettle of fish. You wasn't too much sort of pain injury per se, and you had a big capacity already. But for the normal average person, I wouldn't give it out. It's just not needed. I don't think. I think it's just too much. I just give variations, body weight variations, essentially, the sort of end stage of sort of treatment.
Yeah. So would you say it's mostly good for people who already train regularly and like have some kind of capacity to do it progressively?
Yeah, it's like everything. I was going back to the sort of deadlifting, you know, not crossing the sort of the boundaries, what you can sort of, you know, you can exceed, you know. So we don't want to do more work than what our tissues can handle, because then that can potentially lead to an injury. So just like progressively loading the weight on a conventional deadlift, that's how you do it to a Jefferson curl. So it may just be seated good morning, going back to this one again, just getting them rounded. But it may be a standing pike, going to elephant walk, squat to pike, weighted pike, Jefferson curl. You know, when it's got that sort of like linear progression. How long does that take? Depends on the person. Okay, it depends on how confident they're getting.
Yeah. Trying to think what else can we touch on in terms of the lower back pain. I mean, obviously we could probably talk about the pain itself and the perception of pain. And I don't know how much truth is there in terms of that some people just over exaggerate their pain.
I think so. I think pain demands attention, right? So it draws your attention. So I think once we start to focus on it more, then we start to amplify it more ourselves. So, you know, we start to poke it, we start to prod it, we go on Google, type in something, realize, you know, our life's going to end in the next few hours. So it's a thing what's in the forefront of our mind continuously. So, you know, I feel I try and teach people is like, okay, evaluate it. I tell my patients, let's evaluate it, and then let's try and just dampen the attention what we're giving to it, because you're not going to be able to switch it off continuously, you know. But just to be like, okay, it's a bit annoying. Just reconceptualizing how we sort of think about when we do get a little bit of pain, not to catastrophize and think the worst. A bit of movement's okay, and not to let it absorb all our attention. Again, it's kind of just trying to continue with normal life. Few little bit ways what we can do is we can sort of ease the pain up. A, through sort of exercise if you're getting a good response. B, by a few pain medication. C, by other passive modalities such as heat, cold, massage, tiger balm, all that stuff. And D, a glass of whiskey or something if you want a little tipple. It's fine.
Maybe this is probably more question for me, but I would like to know your kind of point of view on this. I'm guessing you probably don't ever recommend any supplements? Let's say, because you deal with joint pain and you know, these kind of pains as well. So would you ever recommend any joint supplements to anyone?
That's what I asked you for.
I'm just curious what you do.
No, I don't. I don't. But just recently, I've started supplementing, and I think, so when I asked you earlier in another year, I felt ill, right? I felt ill, mate, and I felt really, really ill. Never had it before in my life, mate. I thought I was like, it was awful. Okay, really bad. It wasn't COVID or anything like that. I don't know what it was, but for about sort of 3 or 4 days, I was literally bedridden. Never felt anything like it before. So I think that's when I was like, is it more? You just quite start questioning yourself, don't you? And I was like, is there anything I could have done to not feel like that? So then I started to supplement, and then obviously
Supplement with what?
Multivitamin. That was pretty much it, essentially. Multivitamin, zinc, and magnesium.
I know, that's what
that's what I was doing.
you, really.
But now I'm doing a little bit more. So I got some glucosamine. I wanted to try that out.
Right.
And some D3.
All right.
So I got vitamin.
So did you not supplement these before?
No, I supplemented on and off. But I mean, sparsely across my sort of lifespan. So not much. But this year, for the past 2, maybe 3 months, I've been regularly taking a multivitamin, glucosamine over the last month, zinc and magnesium over. So my multivitamin and zinc and magnesium regularly for about 2, maybe 3 months. The glucosamine has been in for about 1 to 2 months at the minute.
What's the reasoning behind glucosamine?
I was getting, you know, I was aching a little bit from my training, so I was just like, I'm just going to try and just supplement, see if that helps. How does it
taste like?
Pardon?
How does it taste like? Or do you take tablets?
I take tablets.
All right.
Yeah. But you know, it's just, I think all these things you could, like, you know, it should become trial and error. So I'm just testing it out. I want to see what I feel like, and you know, if I do notice the benefits. You know, I feel good taking it. I feel good when I take my tablets. You know, feels like I'm doing something. You know, yeah. But in terms of would I recommend any sort of supplements for back pain? Not really. Yeah. You know, again, pain medication, simple over-the-counter pain medication. If it's affecting their quality of life, you're not sleeping very well, and it is very high levels of pain, of course, pain medication's got its place, okay? But if it's so okay and we can get by without it, I like, look, you know, it's okay.
Yeah. Yeah, I mean, we could go on and on these. There's no touch on supplements, otherwise there would be that's another podcast. Would you add anything to the lower back pain?
No, again, you know, I think when it comes to really serious stuff with lower back pain, it's all quite rare in the grand scheme of things. You know, most back pain is nothing to sort of worry about, and will get better over time. It is wise to keep moving in the early stages. Using pain medication is okay if you feel like you need it. Ice or heat, whichever feels like it gives you some relief. Some movement, easy movement is always great.
Motion is lotion.
Motion is lotion is what we say, yeah. And I'm a big believer in that. And I was just like, you know, some people come with back pain, I was like, just walk a little bit more, you know?
Yeah.
And you think I'm taking a piss, but, you know, that's just fine. And, you know, it's okay to bend your back. It's okay to sit how you want, sleep how you want. I think it's more important to making sure that we're using the spine and movement, and it's more important to focus on movement and activity than it is of what's good and bad positions. So yeah, I think we've covered a lot of stuff for low back, and yeah, I'm quite happy.
Yeah, I think we should probably end it here.
Yeah,
you know, and just keep this as a lower back pain episode.
Yeah,
because we did cover a lot.
Yeah,
and yeah,
perfect.
Thanks for listening.
Cheers.